We want to have a look at what the globe and how the globe is dealing with this coronavirus scourge.
Joachim Yombi Opango, who died in France on Monday, led Congo-Brazzaville from 1977 until he was toppled in 1979. He died at a Paris hospital aged 81. According to his family, he had been ill before he contracted the deadly coronavirus. According to the latest data by the Africa Center for Disease Control on COVID-19 in Africa, there are now more than 5,250 confirmed cases of coronavirus across the continent, 174 deaths, while a total of 335 patients have recovered from the disease. A total of 49 African countries are affected. In East Africa, Mauritius is leading with 128 confirmed cases. Rwanda is second at 70. Kenya has 59 cases. Uganda 33. Ethiopia 23. Tanzania 19. Djibouti 18. Eritrea 12. Seychelles 10. Sudan 6. And Somalia 3 cases. Meanwhile, in the United Kingdom, citizens are heeding the advice to stay at home to keep pressure off the government. UK's chief scientific advisor Patrick Vallance says the social distancing measures are making a difference as the transmission of coronavirus in the community is thought to be decreasing, which could mean fewer infections. Hospital admissions data suggests cases are not rising as fast as feared. There are currently 9,000 people in hospitals in England, up from 6,000 on Friday. The latest number of deaths announced in the UK has reached 1,408. The novel coronavirus has so far infected more than 787,000 people and killed over 37,000 worldwide, according to a survey by Johns Hopkins University.
Thank you. That is our health reporter, Purity Musel, giving us breaking down the statistics and how exactly other countries are dealing with the virus. Just before the break, we had talked about a mask, and we've heard that some people are getting cured, and we know viruses don't have medicine. Kindly, Professor.
Yes, the coronavirus is of the same group of viruses like the common cold, only it's a much more severe disease than the common cold. And you all know that you get a common cold, your body overcomes it, and you get cured. In the same way,
yes.
Coronavirus, when we talk about 80% of the people who have very few symptoms, those folks get better without any medication. Even the ones who are critically ill and get better, we are not sure. We are not sure that the drugs we are actually giving them are the ones that are working, or it's the supportive care we are providing that is healing them. And there are ongoing studies evaluating a number of drugs to see whether they are effective. Yeah.
Plus the mask. How do you use a mask? How long should you be having a mask?
Now, the use of the mask, I think, in these times of coronavirus and in the times of shortage is, and how you use them is an evolving picture. I think what we are very clear is that health workers, and especially your first point of stop in a health facility, the person who does the triage, the person who's going to take your history and find out who you are, needs to wear a mask. And a surgical mask is what is being recommended. And then there are health workers who are working in spaces where the procedures that they do create more aerosol and there's more formite. And in that space, they need to use a higher level mask, what we call an N95. We then have the scenario where this is a corona-infected person, for sure, and they're in a unit where they're in isolation or in a ward where they're in treatment. The health workers there need to be geared up completely with personal protective gear. That's the current recommendations. The discussion that is going on, the other group of people who, as I saw the WHO say, is that the individuals who are having a cold, symptoms of a cold, also need to wear a mask. And as we move away from the hospital to the community, we're saying we don't have enough of the surgical masks, we don't have enough of the N95 masks. Those should be used in hospital. At home, let's find other ways of making a mask, homemade masks, a scarf to cover your mouth, as a way of reducing the number of droplets or aerosol that goes into the air. Yes.
And George, as you're adding on that.
And let me add.
Yes.
And when we talk about health workers and being exposed, it's not just the doctor. It's not just the nurse.
Yes.
There is the person who cleans that room, There's a physiotherapist who comes to do, for example, if you have a severe respiratory illness, you need somebody to do chest physio, it's that health provider. It's the morgue attendant. It's everybody in that chain of care provision. Yeah.
And as you're adding on that, George, the president did announce that his executive was going to be taking pay cuts, and he announced an 80% for his pay, and the deputy and 30-20. We saw also the two leaders of Senate and Parliament also saying they are going to take pay cuts for the next 3 months or so. Do you think and do you believe, because of course being a third world country, we have even challenges of having resources, do you think that that money should be channeled perhaps for the training, for more training of the health workers, and as Dr. Ria has said, everybody that is involved in the care, in the care?
Thank you for that question. Before I move there, maybe let me mention about what Shell talked about, the mask.
Yes.
Because we have mentioned there are two types, the surgical mask.
3 types.
And actually, mostly the one that we're using currently, we have the surgical mask and the N95.
Like this one that the professor has.
This is the surgical mask.
This is the surgical mask,
yes,
which we now widely have, and even the people are using outside there. And we are saying, this one, it is a one-off use. And most of the time, actually, it protects you from the large particles and the sprays. And the thin particles, it might not, because it only cover your mouth, your nose, and it does not cover your eyes. And there is a high a likelihood that once you touch your eyes and you have those, maybe the infection with your hand, there's a possibility also of being infected. And that is why most of the time, majority of the people who have not used this mask, you wait until morning, you have maybe infected yourself, and then you're touching your face because of the irritation you're feeling of putting on a mask. It is also a high risk. So as you do that, you must be able, and I'm saying that the health workers, even the health workers, when we are given with the PPE, it is not just provision. It is the right utilization of that and application of that PPE. So once you use it very well, even when you are taking it off, you can still reinfect yourself. So from putting on to the way you'll take it off is also pure procedures that the health workers and everyone using, whether it's a mask, are supposed to know how. And those are very right measures that the government need to be, and even the media, need to educate people who are using, including masks. So when we talk about that, like the N95, it is a fit. It is not one size fit it all. They are fitting that you need to fit that the one that is fitting you. Okay. So you cannot use any N95 which is provided to you. So, and that is when we say they are not also available, is also something that we need to discuss. Now, how are we going to get them? Because now people who are serving in in the isolation center and subsequently the quarantine center are supposed to be provided with the same. So that is something that the government need to take up. You were asking about I think the health workers?
The pay cuts.
The pay cuts, okay.
What will happen to all that money, but should it be channeled perhaps to give more care and more training to health workers, because you guys are the primary caregivers when it comes to this COVID-19?
Precisely. And I think this is where now most of the time you see some of the NGOs come in and ask transparency from the government, including the union. We are saying they need some transparency. When you say we have bought 1,000 kits, reflect also, tell Kenyans how much you have utilized. When you say we have bought PPEs, tell Kenyans how much you have utilized. Because you don't tell people we have gotten this billion from the World Bank, we have given this money to be used for this, but when you go to spend, you don't tell people how you are spending. We have seen now we want to establish the funds, the funds by the Treasury, which will be now the COVID-19 funds, Kenya chapter. So how will we be able to utilize and tell people that this is how we have used? Transparency is of such a crucial thing that they should even start practicing now. They have now established a committee, I think, which is supposed to to actually run the budgetary and the utilization of the resources that we are providing for COVID-19, but that is an issue. Now, when you say, if indeed that one has happened, I want to believe when they say you have taken several, 80% cut, the money should be channeled to where now we prioritize. What are we prioritizing? And I gave a good example of Sierra Leone. And of course, you need to note that they do not have even a single case up today. So what they are doing, we need to learn from what they have done. And now, they say, even from that time when they had the Ebola, they prioritize the people who are to offer services first. Those are the health workers. Then now you move from there because you have the soldiers to work. Then you supply them with the requisite, or rather the recommended PPEs, and then ensure that all the commodity required are available, which is now a bigger challenge. And of course, you'll see today the health workers are running a hashtag on Twitter on the issues which they need to be prioritized by by the ministry, which is the PPEs which are lacking. Now, the other thing we are seeing, we saw even when we took our people to Ebola, we insured them. Like now, we need to prioritize to give a life insurance to our health workers who are actually in the front line. For instance, if today, God forbid, one of us succumb to this disease, and it is in the line of duty, what happened of their family? I think that's where we call the government to look at what the other countries are prioritizing. They have already, even other countries have given incentives to the health workers so that they are motivated to do the work. They should not feel that like now we are complaining about transport. A majority of the health workers do not have means of transport because by a certain time, we don't have any public mean. So you have to go to your deep pocket to ensure that you are able to have maybe, or rather to hire a car, or even to have an Uber to take you to work, which is also not recommendable because of it is still a public means. Now the government need to come up and say, this is how we need to caution these health workers. And she has mentioned very clearly, the health workers start from the people who are cleaning. It starts from the people who are the record clerks, who receives you there, and it goes up to all the clinical officers, the nurses, and the medical officers. And including, now when it is the health environment, they are, we normally have patients who cannot miss to come to the hospital. Attention seekers. They might even come almost every day. These people, they are likely to get nosocomial infections. And I want to encourage the government that there are simple things, do not need much money, start from there.
And still on government, Senate had some sitting yesterday, and we are expecting the National Assembly to do the same next week. Do you think perhaps we should have some legislation in regard to this coronavirus scourge? Perhaps because they will be ratifying some of the tax incentives that the president gave. Should they take that opportunity perhaps to change some legislation in regard to coronavirus?
Precisely. I think that should be the first thing to do, and even including trying to caution the Kenyans from actually their rentals, because the majority of them are living in rental, which are very high. And I want to applaud one Morithi who I saw from Nakuru, giving the whole month without, you should not take any pay, you should not pay, no, and it is their business rental. So when you look at it now, where we sleep, if at the end of the day, a majority of Kenyans who are not now going to work, they will still be asked to do that. I think that's where now the national government, the National Assembly and also the Senate need to take a responsibility and put measures that will caution Kenyans from these actually like the landlords, and also ensure that now we have heard the Matatu guys asking that the fuel should be able to be, cost should be reduced by 50%, which is very good. Let it take it, because we know the percentage which is taxable, then which is going to tax. Let us bring it down to caution even the commuters who are the health workers and all the other groups which have been classified as the people who will be taking the front line in handling of the coronavirus pandemic. And when you do that, you'll also caution the people who are not able to get anything. Their business is already collapsing. You'll also caution them in the manner they move around.
Professor?
I'd like to, I agree with what you're saying. This is this mitigation. Eh? But when we come to issues like PPEs and masks, every country is facing this problem. So relying on importation.
Actually, somebody is asking what PPE is as
personal protective equipment.
Uh-huh.
It includes it includes what looks
mask,
like a snowman suit,
yes. And
the
goggles.
mask, the hat, the eye shield, the boot covers, gloves. That's the complete personal protection equipment.
Yes.
But depending on the areas you are, you can use lesser, like you may be using just your gloves and a mask and a lab coat. Okay?
Yes.
No, what I was saying is that the government has the ability to do big things. So, for example, we have an EPZ zone that makes clothes for export.
Yes.
We should see what people are doing in other countries. They are they are challenging those. They are helping those production lines.
Yes.
To adjust their production to produce what we need now. To actually mitigate all these problems in the economy, we need to shorten the time when this coronavirus is harassing us. So if our EPZ zone should be making the personal protective equipment, we should be making the masks. You know, we should be making a lot of the products. For example, even this oxygen. The oxygen is an important therapy when you have respiratory failure.
Yes.
Every hospital should be able to concentrate oxygen and not go rely on something coming from outside. So we should have the cylinders for carrying that oxygen. We should have the piping that requires. We are capable of producing this. So that is an initiative that needs to be addressed very urgently. Yeah? I am a public health specialist as well. And we talk of, you have a disease, you have an agent, and you have the host. We've talked about use of protection for the health worker. Very important, because that can be often can be the center of infection. But protection can also be the general public. I'm one of those who believes that the general public should also be wearing a mask.
Okay.
Make a mask. Sew it up. Whatever it is that stops your droplets getting to somebody else will go a long way towards addressing this epidemic. For my fellow health workers, I know we like to be taught everything and sit in a classroom, we debate, we practice, and so that you're competent. We don't have that luxury now. We need to use what is available. We need to use the online platforms to learn. There are lots of videos explaining what needs to be done. We need to have that as a first step. Even as we wait to get further training. But we must be proactive. Otherwise, we'll be completely overrun by this.
I think maybe she need to tell us, because that's why somewhere maybe I feel that maybe it's a point of divergence from her. Yes. Because I need, how do I instill that confidence in the person that I want to be in the front line? I want to believe that learning from from the medias and also the internet is what these health workers are always doing. But how do you really say, I have instilled confidence in the soldiers that I want to take this fight to the next level where I want to go? And this is by listening to the people. You know, you need to get to know the people you are talking to. Indeed, they have that information. Do they have that confidence? And we should not actually, then when we see that this is where the government, all of us, we need to learn. I think all the health workers, by the way, they have the information, they have learned. But we need to move to the point to give them confidence in what they are doing and in anything that they are doing. For instance, I've said about this PPE is how you need to use them. If you have never used them, even including the people who have been said to be the TOT, when they come, the way they use it, and I can tell you, I had one of the Ebola champion, and it was like, they went to Kisii, and they were told, this is not how it's supposed to be done. The person who is an anesthetist, our colleague who is an anesthetist and went to Ebola, had to step in and demonstrate how to put on the PPE and to take them off. We are using even people who are not effective even in training. So we have the people we can use. We normally disregard them because maybe you want people to be somewhere. We are not interested at this where you are, which position you hold. We want to see the government being effective in what they are doing. Remember, we have been calling and saying that the government has neglected the public sector, that's the health sector, the public health sector, which is very true. This is why we are saying we are not where other countries are. We have good policies not implemented all the time. We do not have resources in the Ministry of Health. We are looking the resources. We are looking and saying that we do not have enough resources to buy PPEs to train health workers. What kind of a country are we if we cannot prioritize the health of the workers? And I need to take you back. When the disease started, Kenya refused to go for their people from China. From Wuhan. But they let the plane come in. And by that time, the UK, the US went for their people because they value their people. But when that one happened, what normally happened when we have the bigger people with big position in this country sick? All of them fly out. All of them fly out. This time they are not flying out. They must ensure they have something where they can salvage their situation if anything happened. And we need to say that this is the time that they need to put all the resources. If today it was PPE, the BBI, 10 billion will be available to conduct everything they want. 20 billion will be available even to review the constitution. When we talk about health, they are taking they are taking their hands away and they do not want to say anything. Calling people to contribute. I want to believe we have enough resources to change the healthcare system. And this is what the government need to be strong enough and come out and use the resources we have. We are not doing any project currently. They redirect these resources. And we normally say, look at the Abuja Declaration, which we are a signatory. We said we will give 15% of our national budget to the health sector. Does it happen? Ever since, it has never gone beyond 5%. I think this is where it calls for urgent measures, and the government need to feel strong and direct and actually do the right thing. And it will change our health system for a longer period. We learn from this, and it helps us prepare ourselves.
Professor, perhaps you want to add on something that George has said. There has been concerns that we have very good policies, but the implementation phase actually is the one that is wanting. And now, because it's the only big, let's not call it a project, but it's the only big thing that is happening not only in Kenya and in the world, perhaps.
There are many problems in the health sector. I think that is a given.
Yes.
But in the midst of this, we need to prioritize what we need to do for this the corona illness. And you need to have competent health workers. I agree with the discussion here. But the process of training our health workers cannot be the same as we did for Ebola, because even just bringing people together puts them at risk. You know, that is the challenge. Here at the University of Nairobi, we're trying to teach online, because bringing our students together, who we feel will be better served if we're face-to-face, becomes a source of risk. So we must be willing to experiment, to try out other ways to address this particular problem, and it calls for all of us to do it. And I'm not saying I have the perfect answers. We have the beginning of what needs to be done, but we have to build on it, and we have to be on the same side of the battle.
Let me ask Dr. if she was in
and let me continue. I've been involved in HIV medicine from the beginning, where we needed to actually even scale it up from scratch. And it's always been a grassroots well. Now, if you take very highly specialized careers, like for example, flying, all pilots will tell you they spend a lot of time in simulation to learn the skills before they sit on the plane. Simulation is a video.
Yes.
The same happens to people who are training in surgery. You do simulation, we have simulation labs. So we're saying that there are new tools. We used to learn by face-to-face. You hold my hand and tell me, touch there. This is how I've taught medicine for many years. But this virus is challenging us to do things differently. And we have to be willing, and we have to do it as an emergency if we're to get to where we want to get. So if we take away no other message from this thing for the health workers, please go on the website of Kenyatta National Hospital. It's your national referral hospital.
As we wait for more measures from the government.
We have put resources there
yes.
so that people can start learning. The individuals who he talks of who are experts on how to do PPEs and all that were taken, Kenya government gave health workers to West Africa to go and support them. And the objectives were, one, we're supporting our neighbors, but two, we were learning what to do. And those form the core of the team that are trainers. But even them, when they trained us, because I went online to train, I've learned how to use a PPE, but I haven't used it for a long time. We were learning it online because of this illness doesn't allow us to gather together. This is part of the new lessons on social distancing that we have to, and we have to be willing to do that, right?
Indeed. There are some lessons I wanted us to borrow from Wuhan. Yes. There's something you wanted to add. Perhaps you can add it as we look at what we can learn from Wuhan. It has started picking up. Some businesses have started opening up. What lessons can we borrow? Because they are reducing their cases where the coronavirus started, while other countries, including the developed countries, are just having cases each and every day, some which are startling, over 800, 900 people dying every day. What lessons can we pick from Wuhan?
I think there are big lessons to learn from there, starting from a change of behavior. If you saw what they say 1 meter away from each other, it is done. You cannot do anything apart from what they are saying. When they said it is a lockdown, it was just a lockdown. And we need to say that they are able to do that because by that time, they got all the resources to do what was supposed to be done. They were able to do contact tracing and testing massively. Not the way we are doing, because what we are doing here in Kenya, I normally call it that we are only testing classical symptom patients. Patient with the pure exhibition of classical symptom. Now, like when I came here, I was checked for
the screening
my
for the
temperature.
Yes.
Then what if I didn't have the temperature, but I could simply have maybe be asymptomatic, and I have the disease. So for them, any contact tracing, which I've said in Kenya, we are still at 30%. If we move it to 90%, we will do a greater work. They restricted movement from that one.
Yes.
Which we still have identified high risk here in Kenya. We have not restricted movement. Today we have buses moving to Nakuru and moving everywhere from Nairobi.
Yes.
So have we learned the lesson from there? No. So that is what we need to say. Yes, I have said from what the president has done on the curfew, it is assisting us to some extent. But what happened daytime, where we almost all of us move? We are still moving. So have we identified all the cases overnight and maybe taken them away from other population so we can let other people move? Remember, I need to say that our economical hub have been touched. Wuhan is not the economical hub of the Chinese.
Indeed.
The other cities were running up and running. And that is why they are able even to support themselves and do other things. So if indeed the government was to do something, is to concentrate on ensuring that we do not move from where we are. We ensure that we are able to reduce the spread vividly and be able to demonstrate that indeed, instead of increasing the numbers of cases, they are coming down. So that one demonstrates confidence in the service provider and even the citizen. And that one will tell you that we can now start moving or rather doing other business as supposed to be. There are many lessons that we have not learned.
Professor, you wanted to add something on that?
There's a number of countries where their numbers have gone down.
Yes.
And I think that South Korea is one of them.
Yes.
I think Czechoslovakia was saying the Slovenians are saying that they also have low numbers. And they've done what everybody is doing. So social distancing, they've done contact tracing, they're doing testing. But I think what is coming out in terms of good control is increased widespread testing, but also everybody wearing masks. In Wuhan, you must wear a mask. Everybody,
You've said
everybody.
they are not available.
In 1918, no, in the European country, that's Slovenia, people went and made masks over a period of 3 days.
Sure.
People volunteered and made cotton masks, whatever, and everybody wears a mask. Eh? In 1918, you had the flu pandemic. That was exactly like this.
Which is far much bigger than this.
What finally turned it down was people had to wear a mask, and they were supervised at gunpoint to wear those masks. That's what finally turned it around. So what we're missing in our response right now is that a few people are wearing masks.
And others.
Not everybody is wearing a mask.
It's true.
If you have a good public health intervention to be effective, everybody must do it.
Yes.
And so that to be sort of like the low-lying fruits, in addition to reducing travel up and down, the low-lying fruits is to increase the number of people who are wearing a mask, to reduce the amount of droplets that are in air. These are the droplets that fall on surfaces, then they are re-aerosolized, so that even somebody coming later into a room can get infected. This we can do, and it will be helpful even at household level for members of the household. Now, we don't make our own tests. We actually have to rely on importing the tests, so that's a huge cost. It's being done, but at this point, the testing is being prioritized for people who are coming with symptoms, people who have, in fact, it was prioritized, the people who had come traveled, people who had symptoms, etc. But also there's work going on to move to a state where for people who are symptomatic, to be able to build what is a clinical criteria where we feel you don't have to test everybody to know where they are. Yes.
And
one more thing.
Okay.
Social distancing. We live in a society where we like to hold each other. We hug each other, we greet each other. Even when we're walking, people usually are walking in closer than 1 meter. If you drive along the road and look at people who are walking, everybody is not, most people are not doing that 1 meter. So our actions, our everyday actions are driven by our subconscious mind. You don't think that you're going to walk down a step. You don't think about how you're going to go home. You just go home. So for us to do social distancing, we need to deliberately think about what it means.
Yes.
What actions do I need to change? And I'd like to challenge Kenyan families. In your family, discuss this social distancing. What does it mean? What should I do differently? Monitor each other so that you actually build a new habit and do the old habits of where when I see my best friend, I hug her.
Yes.
We have to deliberately think about it. It's actually a challenging intervention because it's a behavioral intervention that requires you to change the way you think and you do business.
I think I totally agree with Dr. As we do the social distancing, we have a bigger challenge in Kenya. Our setup, we have a lot of informal setups.
Yes.
Which sometimes when we call it social distancing, it will not happen. And if they want to practice this, sometimes they have a lot of difficulties.
Yes.
And we have social places that, and there's common things that we normally share. You understand, like the public toilets, and they need to be actually sprayed or rather be disinfected time to time. Yes. But it's not happening because we use the same door getting in, coming out. Look at what is happening in our matatus. As much as we have restricted to fewer people, I get in without a mask, as she has said.
Yes.
And I have been sanitized, as we have seen, they going in.
Yes.
And when I go in, I'm touching on the supporting pillar by the door.
Itself,
I go in, I touch a number of things which we have touched commonly after going in. Then how many times do we spray that matatus that we are using? Daily. We do not, because we'll come down, then go back. Yes, you give me when I'm going, you sanitize me when I'm going in. But when I'm coming out, I walk away. And then that is what we are saying, that as much as we need to do this, we need to domesticate our own how we need to practice the social distancing and make it effective. And that is why I have said, like we as the union, we have encouraged the government. They need to be candid. Like when we look at Nairobi, the informal setups that we have, as much as, yes, I might use a mask, I go places where other people cannot afford that mask. So even if I use a mask daily, it will be insignificant. It might not help because the people around me are not using mask. At the end of the day, we might end up actually reinfecting myself because we share many other things away from even what I expect as the droplet. So the thing we need to encourage the government, we wrote and said, we can say, let's take a candid move and make selective lockdown of the places where we have identified to be high risk. Within certain specific time, we'll reduce the number from spreading. So when we reduce the number from spreading, we can now actually say, yes, we are not doing it, but we will be forced to do it if at all we don't control the spread. The resources we want to spare now will be forced to be used thereafter. So we can actually say, let's use these resources now, and we reduce the time that will take even when now the spread is high. If it spread to more other places, the time we do for a lockdown, it will take longer, and the resources we'll use is higher than even the one we'll use now. Feed people. And we are asking people that we are not supported. The government can say, let us allocate the 10 billion that we were supposed to use for BBI, feed people from their house, put a total lockdown. This is the move they must make.
And we still on the resources of the government, we have a capacity of around 300 per day. And for testing, and 300 for, I'm quite sure those centers have not yet been distributed across Kenya. Is that also a gray area?
Yes, it's a gray area, because that's why we are saying that the testing is not up to what it's supposed to be. And we have said that the contact tracing is still at 30%. It is likely that a majority of the things we are doing, including test, is either 30% or less. So that's to mean that we could be having other people moving around who are actually COVID-19 positive, and the virus is still spreading. And I have used a good term that we are not importing anymore. We are incubating. And when we are incubating, these things, when it comes out, it become like a bomb to us. And I was looking at the DG, the figures he was giving, that we are likely to have these figures at this time. Around 10,000. So when we look of increasing the number on how we need to test, I think we should actually focus to do it today rather than waiting to increase the testing capacity by tomorrow. I think the capacity should start today rather than waiting for tomorrow. The governors have complained that this thing should be done. Actually, the testing should be done at almost the referral facility of every county. That make it very easy. Now, we have centralized the management of the COVID-19. But when you ask about in specific things like the supply of this PPE, they will tell you, you are employee of the county government. This should not happen because the resources is still centralized. They have done a committee which is centralized, including the Council of Governors. These resources is for all Kenyans. And the taxes that we pay is still collected centrally. We must manage this COVID-19 centrally and ensure that the way we are doing the supply, the training, as they will say that they have trained the people who are in the national government. So what? Do we have a national government away from other people who are in the county? We do not have. We share resources, we share everything. So this is what the government need to do. Ensure that we have the testing centers in every county.
Professor, do you concur with the judge that we need to not only scale up the testing capacity, but also to make sure that they are evenly distributed across the country?
The scaling up of testing is ideal. Yes. If you can find the test kits. Remember, these are new test kits. This is PCR testing. They are new test kits. I think the US licensed their test kit about 2 weeks ago. That's when they started testing widely, and that's why you've seen suddenly there are very many numbers cases around. Yes. I think the test kits that are available from Japan, the test kits from China have had some issues about the quality of testing, having low sensitivity. So even as we talk about scaling up test kits, we need a commodity first. And to find somebody who's producing enough to be able to use for themselves and sell. So that I think is a basic problem. And then the technology of PCR, it is quite scaled up in Kenya because we do PCR for testing for HIV. So the opportunity for, if we have the test kits, I think we have enough sites within Kenya that can actually do it. After all, we do PCR testing of babies. And we do it nationally. And the results, and there's a structure of even sending the results back almost instantaneously on SMS text.
Yeah.
So the capacity is there. But I think the problem is, do we have the test?
Still on the same.
Yes.
Of course.
I think maybe
The
because of the
issue of
PCR centers.
the issue of the centers.
How many are they?
The centers, from the media, I think there are 2 centers that are currently authorized to do the testing. Here in Nairobi, and Moi referral has just been commissioned.
Yes.
Remember, when you have a new lab test, there's a process of testing, training the team, establishing it, training the team, doing quality assurance, to be clear that the results you give are actually real. So Moi has been done that. I don't think there's merit in saying that it will be evenly distributed, because the epidemic is not evenly distributed. So the priority will first of all be the regions where you have cases, because that's where the greatest need is, to try and find them before they find their way into other places.
And today, an interesting official statement from the Kenya Veterinary Board to veterinary professionals and members of the public, of course, to observe precautionary measures when handling animals. It's actually in one of the dailies, and it's actually on a full page. What do you have to say regarding that, George? Should we start having other concerns when it comes to animals?
Yeah, but where we are, I don't think that it should be a cause of alarm in our country. However, we want maybe to look from which perspective they come from.
Yes.
But where we are, I don't think it is a bigger concern as currently. Maybe the focus and the priority is still somewhere else.
Professor?
I was just going to say that most of these outbreaks you see in human populations are what we call zoonosis. So the disease that was in animals that jumped into human race. And this is the same thing thinking about this coronavirus, that they have not really identified the animal species from which it jumped into human population and became this pandemic. So the urging of the veterinarians that people must be careful is that you don't know which will be the next pandemic.
Yes.
So learning good habits. This event should trigger in us to learn good habits. That good habits may actually prevent you from ever meeting another of this sort of zoonosis. So that's the principle by which this is being done. And then, of course, there are zoonosis. There are outbreaks that you can have, like anthrax is a zoonosis.
Which would add more problems to the current situation as we have it.
Things like the plague, if rats become, we have an increase in number of rats, the risk of plague is there. But usually those are short, more contained outbreaks, because the mortality is very high. Quickly, it's sorted out. But certainly zoonosis it's the main infectious disease today.
Interesting topic we are having, but unfortunately, my director informs me that we are almost running out of time. So kindly, 1 minute each. We had a lot to look at, even the social. Some people have argued that this quarantine and the social distancing could perhaps affect people, because humans are social creatures. But 1 minute, what are we supposed to do as in the current situation when it comes, and especially to the primary caregivers, of which both of you are?
Thank you very much. I need to be very specific that this is a global problem. We have it. The workers and what we are calling the frontline health workers are learning at work. But we can actually build that capacity by assisting them, or rather helping them in capacitating them, by training them and giving them the right equipment, personal equipment, protective equipment. And when we do that, we will ensure that now we can do community sensitization about how they need to behave, to ensure that what we are calling social distancing and change of behavior can be able to be inculcated in people and practiced during this time of this outbreak. And we need to say that this disease, yes, it is a scare, it is killing people, but it is not a death sentence. We need to encourage our health workers to take it to themselves, learn about it. Let us protect our people. We are the one who must provide the answers. The government must be candid and took on the measures that we have said, build the capacity of the health workers, employ more, and train them to do the work they are supposed to be. Ensure that these health workers, give them life insurance. This is something that are psychological, but they support them to do the work. They might not help them, because if you die, you'll not benefit from your insurance. It will only give you a psychological impetus to continue providing the services that you're supposed to be
Thank
doing.
you.
And
Professor,
involve
1 minute.
all health stakeholders,
Okay.
all
Everyone.
stakeholders.
Powerful words.
Yeah.
Professor, 1 minute, kindly.
I think the bottom line, I'll address myself to the general public.
Yes.
And I think the bottom line is wash your hands, observe cough hygiene, and work on social distancing. And be deliberate about it. I'll echo the words of the Maendeleo ya Wanawake chairman that hold your children accountable, even those young adults. As parents, hold them accountable. Let social distancing be social distancing. Let us not increase the problem for our nation. Yeah.
Thank you so much indeed for making time for News Check. I have been speaking to two medical practitioners. You do remember that they are the primary caregivers when it comes to the coronavirus. We had Professor Ruth Nduati, who is not only a pediatrician, she is also a lecturer at the University of Nairobi School of Medicine, and George Gibore, who is the General Secretary for Kenya Union of Clinical Officers. And the message is very, very clear. Keep safe, keep clean, keep the distance, and keep the faith. I'm Ben Troy Njue. Lucy Mwaura has been my co-anchor on the bottom right of your screen. But don't go away, because my colleague is on standby with our Swahili version, Tamrini.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands, or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days. Dial *719# or call 719. This message has been brought to you by the Government of Kenya and its partners.
Next on.
Ikiwa utaendelea kupambana na yeye, utaishia patupu tu, unajua?
Sikiliza, hebu usinilaumu sana sasa.
Hebu nijibu tu kwanza, ni yeye alikupigia kunikosoa au ni mtu mwingine?
Loyuju, tulia tafadhali.
Niambie, unaweza kupata kiasi gani kwa vitu hivyo?
Sasa nyie wawili mnapigana, wakati Fernanda anafaidika.
Kwa nini mnafanya?
Simamisha gari! Fungua mlango! Shayu!
Since late last year, the coronavirus COVID-19 has emerged as a serious healthcare threat. This is an infection that has gone global and none has been spared. The government, through the Ministry of Health, has put in measures to keep Kenyans safe against COVID-19, which is currently rampant around the world, with new confirmed infections and death cases daily. Such sanitization and screening of visitors at this border post and across every entry point in the country is very vital in preventing the spread of the disease in the country.
I'm very happy about the screenings that are going on in Tanzania and Kenya. I think it's very proactive that you're thinking about stopping it at the border so that it does not spread.
It is scary that a single cough here can lead to an outbreak of epic proportions. In order to prevent that, the government has instituted measures to keep Kenyans safe.
The facility has all the equipments you need, from handling a basic patient up to ICU setting.
However, you also have a role to play in preventing spread of infections.
Members of the public are encouraged to remain vigilant
as the risk is still high. Let's maintain basic hand and respiratory hygiene.
It's just our general hygiene, okay? And that now means at workplaces, we should ensure that our work surfaces are clean.
Always ensure that nimefanya proper sanitation ya mikono. Every time na board matatu, lazima ni sanitize mikono.
We have faced many severe challenges as a nation, and we have always found a way to rise above them. COVID-19 is no different, and we will overcome the pandemic. Stop coronavirus. Follow all directives from the Ministry of Health. Wash your hands properly.
Coronavirus COVID-19 is a respiratory virus spreading across the world. The infection is spread from droplets of coughing and sneezing of an infected person, touching or shaking hands or being in contact with contaminated surfaces or objects with the virus. The signs and symptoms are fever, coughing, headache, body ache, difficulty in breathing. The disease can be prevented by regularly washing hands with soap and running water. Avoid close contact with people who have flu-like symptoms. Avoid handshake, hugs, and kissing. Also, protect yourself by covering your mouth or nose using a disposable tissue while coughing or sneezing. If you experience these symptoms and you had traveled or been in contact with a person from a country reporting COVID-19, you should isolate yourself for 14 days. Dial *719# or call 719. This message has been brought to you by the Government of Kenya and its partners.
Weekend on KBC Channel 1.
Kamene, this is the kind of message you start with while asking for help. This is a very good deal, Kamene.
This is a very good deal and it is exquisite.
Waria, you're worried about the breakfast. You are bana satuka urembo na evaporate. Your beauty is back to factory reset.
That is why I prefer all natural. What you see is what you have.
How do I know for sure you have not washed your kid in this container?
You are the customer. How can you wash a kid in that small thing?
Who spoke to you? You cement peddler. You think everyone is eating such cheap pig food?
Classmates, every Saturday on KBC.
Before, but they were really nice. They were very supportive, the doctors as well, and the cleaners who came to clean my room. They used to talk to me a lot because sometimes I was very emotional, but I would like to assure everyone, all the Kenyans, that this is something that can be managed. It's treatable, and sometimes you may show very, very mild symptoms, just a cough and a headache, but when you see that, you're supposed, you know, as a responsible Kenyan citizen, you should contact the authorities and tell them I'm not feeling well, this is how I'm feeling, and be, you know, come forward and be confident because they're going to treat you and they're going to do everything for you. So that's all I have to say. Thank you very much.